the situation has gone from what was pretty much a catastrophe because they had the Mpox outbreaks. And then all of a sudden in late January, conflict broke out. But this is the environment that they're in, a conflict, a disease outbreak. They need supplies, they need support. And so at the moment, they are facing multiple crises that are really very, very lethal to children. But of course, there's still insecurity. There are no police. The prisons are emptied. There's a curfew. There's been levels of rape against children that are just horrific. Areas where there's Mpox, areas where there's a nutritional crisis, and we try to get in the supplies, the child psychologists, the vaccines, but we can't reach everywhere. No, the point is that there are people out there who are not being reached, and that means their situation is even more dire. The reports coming in are around a child is raped every 30 minutes. I mean, this should push everybody into action, into more prevention services, and to make sure perpetrators are held accountable. If fighting continues and if funding continues to disappear, millions of children are at risk. It's that simple. Millions of lives are at risk, and it would be a mistake for the world to think this is isolated. We live in a very globalized world. You've had major disease outbreaks, Ebola, Mpox, emanating out of this area. Now, they can only be stopped when we strengthen a health system. We can only do that with funding and with peace. So it's a mistake to believe this is isolated here. The world is connected. What the problems are here will spread unless they are addressed at a political level and a financial level.